To see everybody back with us again this week. We also have some new folks who are joining us, so thanks very much. My name is Elizabeth Murphy. I'm the Director of Creative New Jersey, and on behalf of Casey O'Brien and Jeanette Mitchell, we'd like to welcome you to today's briefing. Many of you know that today's briefing is the fifth in a series of statewide calls that we've been holding in response to COVID-19. So as Casey said a couple of minutes ago, we're going through the end of May. Some of you have been on some of our earlier calls. Our colleagues and friends at the Center for Nonprofits joined us for an update on the CARES Act, which is how we started on April 1st. We're grateful to our colleagues at the Council of New Jersey Grantmakers and the New Jersey Community Capital who briefed us on some philanthropic funds. Our friends in the media world at the Center for Cooperative Media and Shelterforce and WBGO did a media briefing for us on how local journalists are responding and some of those particular needs. And then last week we were joined by our colleagues and friends at NJ Spotlight and I'm blanking. But we had an
Patrick Wall.
And Patrick Wall from Chalkbeat, exactly. And we were able to hold.
And then Angela Garrettson.
Angela Garrettson, NJIT. Thank you, Casey. Casey's the other half of my brain, as many of you know. So we had a briefing on education and sort of the state of education K through 12, and then for higher ed. So today we're having a mental health briefing. And we know because of our cross-sector work at Creative New Jersey, we were able to activate our own statewide cross-sector network in order to do these briefings. And some of you on the call today have been working with us in order to make that happen. So we just want to thank all of you who have been a part of this work. We know how important it is to help keep networks strong and help keep people engaged. Misinformation can be rampant during a time of crisis. So we're grateful to our trusted sources of folks who have come on these calls and have shared their knowledge and expertise with us. All of you are connected to other networks throughout the state. So I hope that the information that you learn here today, you will take that forward and you'll share that with people in your own communities and your own networks. Casey referenced the summary reports that we've been doing after each of these calls. They can be found on our website. Please, if you think they're useful, share them widely. They've got lots of links in them. And together, all of us together can actually reach a lot of New Jersey, right? So we've got other people who we're interacting with who are not on the calls, this morning, but who we follow up with after each of these calls. So anyway, we want to thank you very much for being a part of our network. And please continue to let us know other ways that you think Creative New Jersey might be able to be of service. So we're really grateful to our colleagues at the Mental Health Association in New Jersey, the Disaster and Terrorism Branch within the Division of Mental Health and Addiction Services at the Department of Human Services, and the Department of Children and Families, Children's System of Care, also at the state, who have agreed to be with us on the call this morning to share some information about protecting mental health and the challenges that certain populations are experiencing regarding mental health and child mental health during the pandemic. So before I introduce our first speaker, let's just take a moment to bring our attention, right, sort of to the center of the Zoom room. I'm going to ask us all to just take a deep breath. We all do so many Zoom calls these days, and I think sometimes we can forget to be fully present. These are conversations with each other, right? So what everybody has to contribute is really important. And the way that we can participate fully is to try to bring all of our attention, together and in support of each other. So thanks for doing that. Casey, before we introduce Jaime, who's our first speaker, is there anything else that you want to say about how we're running the call today?
When we get to the Q&A section, I'll give everybody instructions on how that's going to run so we can review that when we get there.
Great. Okay. So our first guest speaker this morning is Jaime Angelini. Jaime is the Director of Consumer Services at the Mental Health Association in New Jersey in Atlantic County. And we're going to follow Jaime's talk by a Q&A. So Jamie will, after Jamie's Q&A, we're going to hear from Megan Sullivan, who's Deputy Director at the Disaster and Terrorism Branch within the Department of Mental Health and Addiction Services. And that will be followed by Dr. Diana Salvador, who's the Clinical Director at the Department of Children and Families. So now it's my pleasure to introduce Jaime Angelini. She's going to talk a little bit about that 30,000-foot view regarding mental health. Jaime, you can unmute yourself. And I know all of us join me in welcoming you to the call today, and thank you for being with us.
Good morning, everyone. Thank you for having me. And thank you for starting with a little bit of that grounding exercise. I think that's a nice way to get going. I am Jaime Angelini. I am with the Mental Health Association of New Jersey, where I have been the last 19 years. I am a mental health advocate and a mental health educator. I did a lot of disaster mental health response work after Hurricane Sandy. I know that this COVID situation is nothing like Sandy, but it's the closest we have to really some of our response work and how we can relate it. I'm going to talk broadly about what the Mental Health Association has been doing. I could spend all day talking about each program and what we do there, but really broadly, I just want to talk about the work that we have been doing since the pandemic started, we'll say. For me, I always kind of use March 16th because that's the first day I started working from home and my life changed very drastically. And at that time, we started as an organization to really figure out how we could continue to provide the good work that we do in the community in a way that's being done virtually. So we worked to really take all of our in-person work and put it online, doing Zooms just like this. So the work that we're doing with consumers and families who are living with mental health challenges, we started making phone calls and providing telephonic case management and support. And then we also took all of our in-person support groups and made them virtual. And one of the things that we were really worried about was not so much that individuals living with mental health challenges would react worse because of the pandemic, but it was really about routine being disrupted. So for individuals who those are their coping skills, going to a support group or having their case manager or seeing a mental health professional, to have that disrupted would be very challenging. So we started to create our Zoom groups and our call-in groups of what we already had in place. But then we started to create new groups because we were seeing additional needs. So we created a group for parents, a group for teachers, a group for healthcare workers. So we went kind of beyond our scope of what we were traditionally doing to work with and meet the need of the community because of COVID-19. So broadly, we are providing probably about 50 different virtual support groups and telephone case management throughout the state for anyone who wants to call in. We're also getting people from out of the state, which we never had before. So it's kind of interesting. Last week, we had a few people from Massachusetts call in because they saw our support group listed somewhere. So I think we're also tapping into some new folks that we didn't see before. We have our call line that I know Casey's going to share the slides, and that's something that I really want to make sure that I'm leaving you with today, because as a partner, and I see you all as partners in New Jersey, I want to make sure that you can share this phone number with your constituents, with your family, with your friends, with your nonprofits, 1-866-202-HELP. And this call line is there to support anybody who needs just a little bit of emotional support during this time. And as you can imagine, we are seeing a lot of first-time callers who are calling about anxiety and depression and worry due to COVID. It's confidential, it's 7 days a week, it operates 8 a.m. to 8 p.m. And we're really providing just really that emotional presence. So it's not traditional counseling, it's not therapeutic counseling, but it's a way to talk to people about their reactions to this disaster, validating and normalizing those reactions, but also promoting coping skills, working to mitigate stress, and recognizing that if that caller does need additional support, we can make that proper referral. So, I definitely want to make sure that we are sharing that call line with everybody in New Jersey. The call center, as you can imagine, is 100% remote. We are spending about 23 minutes on the phone with people. And typically our call line would spend about 10 to 12 minutes on the phone. So that just gives you some idea, some indication as, what the needs are and why people are calling. we are hearing from everyone, parents, healthcare workers, frontline workers, first responders, who are calling in just to talk about their worries. And what we want to remember, you know, when it comes to emotional health around disaster, is that everyone's reaction will be different, and we want to validate and honor everyone's feelings. So, you know, I've heard people say, I've had the honor of speaking to so many people the last few weeks, and I've had healthcare workers say, it's devastating to watch my patients die, and I'm anxious and I'm worried and I need to talk that through. And I've also had parents say, it's an impossible task to be home with 4 young kids, and I'm worried and terrified of getting sick. So we see all ends of the spectrum here. And I think the most important thing is that as a group for us, that we can honor and validate the feelings of people we're talking to, let them know that help is available, immediate help that people can call the call line. And we also are looking to all of you on the call to say, if you're interested in partnerships, and I think Casey's going to put up a poll to kind of, you know, take a pulse of the people on this call today. If you're interested in partnerships with the Mental Health Association, and we can in some way partner and support you in putting together a webinar or a support group, or just gathering basic needs for your members, your staff, your team, those who you're caring for in your professional world, we want to be able to do that. So please fill out the poll. We can partner and really design what might work best. But we are here. We're here to provide emotional support for New Jersey, and we want to partner. We want to really make sure that we are validating the feelings of everyone, because we've never gone through anything like this before. We can't compare it to anything else, and we don't know what the long-term mental health needs will be.
And I apologize, folks. I originally put up an older poll. That's the wrong one. Let me get the right poll up there for you. Hang on one second.
Thanks, Casey.
And then, yeah, thank you. Let me end this one and get you the right one. Poll number 5. Here we go. So the poll I'm going to launch right now says, are you interested in working with the Mental Health Association in New Jersey and New Jersey Hope and Healing to develop a presentation on COVID-19 mental health resources for your organizations or groups, clients, or membership? So for those of you who are on video and can see that, please fill out that poll. We'll leave it open for another couple of seconds while folks are filling that out, and then I will end the poll, and we'll be able to connect those of you who said yes with Jaime. Jaime, while we're waiting for the poll to finish, there was a question that came up in the chat box, particularly about how Spanish speakers get tracked to a Spanish language counselor, presumably when they call. If you can talk a little bit about that, that would be great.
Yep, absolutely. So we have bilingual staff on the call lines, and also specific Spanish-speaking support groups, so that individuals can speak with someone and then focus on getting the proper referrals for their preferred language.
Great. Thank you so much for that. Okay, so I'm going to give the poll just another couple of seconds, and then, of course, for anyone else who wants to get in touch with Jaime and with the Mental Health Association in New Jersey, you can reach out via their website and contact Jaime as well. Jaime, as you may be aware, has been on many of our calls already, the ones that we have been doing previously, and she's always been dropping in information about the hotlines that folks can call. So we're certainly grateful, Jaime, that you've been doing that all along as well. I'm going to go ahead and end the polling now, and then we can open it up to Q&A, I think, unless there was anything else that you wanted to address, Jaime.
No, I think next, my partner at the state, Megan Sullivan, is going to talk a lot about the New Jersey Hope and Healing program that we're partnering with, and we'll be able to really talk to you to that situation and the great work that we're doing.
Great, that's wonderful. All right, so folks, we're going to open this up for Q&A right now. Again, if you are on video call with us, make sure your participants button is open and click the little blue hand icon so that you can raise your hand, so I'll know if you've got a question for Jaime. You can also drop a question into the chat box. And then I know there's a couple of folks who are with us just on the phone. So if you have a question from the phone lines and you're only on phone, then you can *6 to unmute yourself and go ahead and ask your question. So I'm just going to quickly scroll through the chat box here, see if there are any other questions that came up.
Amy, I have a question for you just while we're looking through chat and maybe while some other folks are formulating their question. I wonder, you know, I worked with some of you and some other folks after Hurricane Sandy on the recovery, and I wonder if you and your colleagues at the Mental Health Association in New Jersey are talking about some of the longer term, you know, issues that you see, you know, 12 months, 18 months, 24 months out. You know, I remember we had a lot of learning after September 11th and after Sandy that sometimes, you know, mental health issues and challenges don't present for us as people until we're actually out of crisis. And then somehow, you know, life gets back to normal and we realize then, you know, individuals, humans, we need more assistance then. So I just wonder if you can share a little bit about if you and your colleagues are talking about that yet.
Yes, we absolutely are. And I think we are planning for the short and the long term, because I think you're right, Elizabeth. We will see individuals that, for lack of a better word, bounce back. And then we will see individuals that are having a really difficult time getting back to their, what we call kind of pre-disaster level of functioning. So we are looking at the short and long term and really trying to think about how we can have supports in place for a period of time. I mean, like you say, after Hurricane Sandy, I mean, we provided case management, support, crisis counseling, you know, it probably for 2 years after in some way or another. And I think we're going to need to do the same as a state and as a whole, and as a mental health system in general. We have to be prepared for the long-term effects, because when people, as you said, come back out of this and return to their life before, it's going to look different. Our lives have been changed forever, really, and we need to be prepared for that. So we're supporting people in New Jersey the best way we can for their mental health long-term.
Yep. Thanks, Jamie.
Yeah.
Great. Okay, as of right now, I'm not seeing any other questions. There will be opportunities to ask those again in the future. So I think, Elizabeth, we can move on to our next speaker.
Great. Thanks again, Jamie. And I know you can stay with us throughout the call today just for some other points that might be raised. So our next speaker is Megan Sullivan. And Megan is Deputy Director for the Disaster and Terrorism Branch within the Division of Mental Health and Addiction Services in the Department of Human Services at the state. So as Jamie mentioned, Megan is going to share some more detail about the crisis counseling program. And Megan, you can unmute yourself. You're unmuted. And so I know everybody on the call joins me in welcoming you and thanks you for being with us. So.
Morning, thank you.
Morning.
Just a little history, because I think that the Disaster and Terrorism Branch is kind of like the best kept secret in the Division of Mental Health and Addiction Services, but we're functioning all the time. I'll talk about some of the crisis counseling programs that we've done previous to this, but we were made official after 9/11. We've done work since Hurricane Floyd. We have crisis counselors throughout the state who've been very involved. But after 9/11, a widow had found us very helpful and had worked with Governor Cody at the time to make sure that we became an official branch. So we are constantly planning for disaster. We do a tremendous amount of training. We have a program called the Disaster Response Crisis Counselor Program. If you're familiar with other volunteer programs like the Medical Reserve Corps, Community Emergency Response Teams, the DRCC, Disaster Response Crisis Counselor Program, has about 500 at any given time crisis counseling volunteers throughout the state. And these don't need to be licensed clinicians. We train people in psychological first aid, disaster mental health, so that they are able to help. It's a FEMA-based neighbor helping neighbor model. So that's what we use right now. So when any kind of disaster happens, we have volunteers ready to go, ready to respond. So I'll talk a little bit about what they've been doing so far. But now we're in a phase where we're getting a crisis counseling program, which is a grant from FEMA and SAMHSA, and it goes in 2 phases, and Jamie kind of alluded to this, short-term and long-term. Right now, last Thursday, we've been awarded the ISP, the Immediate Services Program. So we have funding from FEMA and SAMHSA and a lot of oversight to meet the emotional needs. So if we're looking back at other CCP programs, by the way, that's what New Jersey Hope and Healing is. It's the Crisis Counseling Program grant. So if you look back at other disasters, Jamie had mentioned Hurricane or Superstorm Sandy. This is so different because one, it affects the whole state. More like 9/11, where it affects the whole state in many different ways. If you look back to 9/11, back then the grant we had was called Project Phoenix, about rising from the ashes. And people were impacted in many ways. One, maybe they knew somebody, maybe they escaped a building. Two, everybody felt a little edgy, right? Everybody felt like, who knows what's next? That ambient fear is more like what we're having now, where everybody just feels a little on edge. We don't know if we're safe, much like the threat of terrorism. The third was people that were economically impacted. Certainly that happened during 9/11. People lost their jobs in the city. Some people were afraid to go back to the city, and there was a great economic impact. So financial stress leads to other mental health issues. So we're absolutely seeing that with this crisis as well. So we're trying to look at all of those emotional impacts in our planning. So right now we have, and I'm so glad Jamie put those cards up, because we're trying to support the Mental Health Association call line. For example, we're setting up a program so that they can shorten their calls and do the immediate needs on the calls and get back to taking more calls. So we're having our crisis counselors, as well as some graduate interns who we've trained, who lost their internships because they were supposed to be doing hours this semester. So they were counseling interns, and we're training them, embedding them, et cetera, to call people back that are calling the mental health cares line, to call them back and say, if you need to talk to a crisis counselor, we're here. So we're going to be reaching out, more proactive. One of the things about the crisis counseling program is always about its outreach driven. We're not setting up offices and saying, come in or find us. The whole mindset of the crisis counseling program is that we're doing outreach. So we're trying to look at those most vulnerable populations. Some of them, obviously, is first responders, right? We've set up Zoom support drop-in meetings, right? They're not too organized, right? We want people to be able to come in and talk about what's going on with them. So Zoom drop-in sessions for EMS, for medical communities, for healthcare communities. And we're going to be looking at other first responders. We're working closely with the Attorney General's office on programming there. We are looking at how to help all the access and functional needs. We sit on other groups, right? We sit on the mass care support calls. We sit on the access and functional needs support meetings, which is looking at dialysis patients and other patients who are seriously impacted, people with mental health issues, people with substance use disorders. One of my jobs with the state is to monitor the COOP plans, or the continuity of operation plans, for opiate treatment providers, because we have a number of people, usually about 15,000 people in New Jersey, who get some kind of medication-assisted treatment for opiate disorders. One of the things we were talking about last year this time was how many people we were losing to overdoses. We don't want those numbers to increase, right? So the substance abuse needs. One thing we learned after 9/11 was typically you don't see a whole bunch of new substance abuse problems after disasters, or at least that kind of disaster. What you see is a lot of people who are on the edge abusing it, people that already were drinking a half a bottle of wine to go to sleep, having more problems. But you see a lot more relapse, people who are living in long-term recovery. There's about 20 million people in the United States living in long-term recovery from substance abuse disorders, and relapse is a high risk during crisis. So that's population. We're looking at trying to reach out to those dealing with domestic violence, which we know those numbers are up. I'm not going to talk about kids because Dr. Diana Salvador is going to talk more about that. Undocumented populations who are afraid to go to any kind of government agency. So one of the things the crisis counseling program does, when the feds give us money, we look in the state on who's already being very efficient, right? So the Mental Health Association is one of our partners because they're working all the time. We know that if you look at the general population, about 1 in 5 people already suffers from some measurable level of anxiety. This obviously increases it. So we work with the Mental Health Association. For this ISP, we're working with Catholic Charities throughout the state, and we're working with Family Services Bureau in North Jersey because they have great language capacity for many different languages spoken in. We are a great melting pot in New Jersey. So we're trying to meet all those needs. So right now we're mostly working, and I'm glad, before the call somebody mentioned the New Jersey VOADs. New Jersey VOADs are voluntary organizations active in disaster. So we meet with them regularly every Monday morning on their calls to let them know what resources we have and find out where those needs are. Because as this crisis counseling program goes along, and you were asking about length of time and when people are impacted, when I think about Hurricane Sandy, that crisis counseling program, if you work in the FEMA world, they're supposed to last all for about 9 months, maybe to a year. That one was 15 months. The crisis counseling program after 9/11 was about 3 years, because people do have trouble. They think, okay, when their immediate health and safety's secure, they feel like, okay, I'm going to be okay now. And then they don't understand why they don't feel right. They have trouble getting back to normal, or as Jaime says, their pre-disaster level of functioning. So we're planning for those long-term needs, whether it's because of the financial stress they're going through right now, whether it's because of grief and loss issues, which are going to be a very real issue in New Jersey, whether it's because the kids are disrupted with school. One of the things we want to be careful of is it's not post-traumatic stress disorder, right? We don't want to diagnose everybody. Many of these are not diagnosable conditions, but they are this free-floating anxiety after this level of trauma. So we want to address that so people can get back to their normal level of functioning. So mostly we're doing a lot of, it's tough because, as I said, we do outreach, and right now it's all telehealth, right? It's all virtual. So as Jaime said, they're using a lot of Zoom support groups. We're doing Zoom support groups. We're doing a lot of webinars on coping, on operational stress, etc. And we're just trying to do outreach. So if you are familiar with an area that really needs outreach, let us know. We would certainly love to do that. I think that's really the highlights.
Great. Thanks so much, Megan. Thanks for all of that information. So I'll turn it over to Casey if anybody's got some questions for Megan right now.
I did put my email up in case somebody wants to reach out.
Yep. Thanks, Megan. And
Thanks, Megan.
Your contact information is in the summary report. So for everybody,
Great.
Jaime and Megan and Diana. Right.
And just a reminder to use the little blue icon in your participants to raise your hand if you have a question at this time. If you're joining us just by phone, you can *6 to unmute yourself, or you can drop a question into the chat. There was one question of clarification, and I don't know if you can answer this, Megan. How many people do you think are in long-term recovery from presumably addiction in our state? Do you have a sense of that?
In our state, no. I know nationally
Okay.
They say 23 million.
Okay, great. Thank you. So there's a question here about there's a stigma in Latino communities aside from security issues about seeking mental health services. Can you speak to that at all and any of your experiences in trying to reach Latino communities?
It is true. We have seen that absolutely. And not just Latino communities. We saw after 9/11, certain communities in Hudson County, certain Asian communities where they would just, it becomes psychosomatic. They get headaches. They can't talk about mental health. Latino communities, it's a sign of weakness to need to talk to somebody outside the family. So the best thing that we do is we employ agencies. We work with agencies that are already doing other things in those communities, right? It's where maybe you're getting your extra assistance for something else. We want to work with programs that already have those connections. It's never helpful if I come in and say, hi, I'm from the government, I'm here to help, right? It just never goes over well. So what we do is we find boots on the ground that are already trusted partners in the community, obviously who speak the language, who understand the culture, who are culture brokers, and we help work with them and support them.
Great, thank you. I'm not seeing any other questions just at present popping in. There may be some more later on. So I think we'll go ahead and move on to our final speaker for the call today. Thank you.
Great. Thanks again, Megan. So our third guest speaker today is Dr. Diana Salvador. Diana is the clinical director at the Department of Children and Families and the Children's System of Care at the state. So I know everybody joins me in welcoming Diana, and you've unmuted yourself, and thanks so much for being with us this morning.
You got it. I hope there's not feedback because I'm joining by phone. Good morning, everybody. Good morning, everybody. I want to just take some time this morning to briefly talk about how the pandemic has impacted our youth and some resources that are available to support our youth and their families in New Jersey. As a child psychologist, I think the biggest challenge that I see our youth facing today is two factors, both just the disruption of their routine and the disconnection they're experiencing from others. In terms of disruption of routine, you know, our schools are the most regimented place that our kids live in our world, right? And they're told when they're allowed to go to the bathroom, when they can eat, when they're supposed to do work on demand. And the pandemic has sort of removed that routine, that schedule, that consistency that provides a sense of safety and comfort for many of our children, and even for children that do not like school. There's a certain comfort level that they experience from being surrounded with a lot of predictability and in many cases feelings of safety. The other thing that has arisen since the pandemic and since our kids have been relegated to their homes is this significant disconnection from others. The people that they used to see on a daily basis, whether it just be the janitor in the school hallway, the person or the kid at the locker next to theirs, you know, their favorite teacher or maybe their least favorite teacher, not being able to maintain that connection with other people in their day-to-day lives and having their network of social supports really limited in a very significant way. This disruption of schedule and disconnection from others, combined with this sort of loss of life as we know it today, and there's really no end in sight, really begs us to look at this pandemic with a trauma lens when we think about how our kids are functioning. You know, for our young ones developmentally, they may not know exactly what's going on, but our kids know when something isn't right and when there's been a shift in how the world is functioning around them. For our more mature kids, you know, they have and our older youth, they have an awareness that this is something very significant, that it can impact people that they love and that they know, including themselves. And it can bring about a lot of fear and anxiety under normal and typical circumstances. It can give rise to sadness, anger, hyperactivity. Developmentally, our kids may show their fear and anxiety in different ways based on who they are and their temperament, their age. But I think all of our kids to some degree are having what I consider a very healthy reaction to a healthy sense of fear that I think we're all feeling in our world right now. This is even more difficult for our youth and our families who are already struggling with behavioral health issues in their own lives, and it can exacerbate existing symptoms and give rise to more serious behavioral health issues that need to be addressed in a more comprehensive fashion. You know, I would be remiss if I also didn't mention, and I think this has been mentioned by the two previous speakers, that, you know, when we think of a youth and a family system and the world in which they live, nothing is left untouched. So for our families who are really struggling already at baseline with food insecurity, with unemployment, with domestic violence in the home, for our kids who are vulnerable to abuse and neglect, or if they have caregivers who abuse substances, these circumstances, these social and environmental challenges can be really compounded at a time like this. And in combination with this disconnect from people outside their home and their more immediate world, we can see our more vulnerable kids sort of exhibiting an increasing risk in terms of their mental health and well-being. The number one way that we can help our kids is by tuning in and listening. We have to create less disruption and as we sort of move toward this new routine and structure, and more opportunities for connection. And for some people, this is very simple. You know, not a lot has to be done. You know, it could be as simple as creating a schedule for a child at home that it really creates some kind of predictability and routine around their daily lives. For others, it requires more comprehensive support. And I always like to say, as a child psychologist, I really don't believe that therapy is for everyone. there's a lot of different ways that we can support our youth and people in general, whether it's relying on faith-based relationships, family, again, more tangible, concrete, sort of built-in ways of managing and coping with day-to-day issues like a daily schedule. But for those kids who really start to demonstrate an inability to function, a very significant deviation from their baseline. So they're not taking care of their, they're not attending to their hygiene. They're not engaging in their daily living activities. Maybe they're more isolated. Their mood has sort of shifted more significantly and for an extended period of time. An 11-year-old is now climbing in bed with mom and refusing to sleep in their own bed. I think that's when we need to really think about what additional supports we can mobilize in our community that can really help support the entire family system during this difficult time. And there's a lot of ways to do that. I think one of the links that I asked Casey to share is for the second floor hotline, which is run by 180 Turning Lives Around. It's a program that's funded and contracted by the Department of Children and Families, and they run a helpline, and youth of all ages can call or text. A lot of our youth are relying on text messaging, and speak to somebody on the other line who's a professional 24 hours a day, 7 days a week. That's a resource that a lot of kids are comfortable with because it's anonymous and confidential, and you can be assured that there's a healthy adult on the other end answering the call and providing support as needed and elevating issues as needed to support the youth if there's something more serious going on. In terms of our services at the Children's System of Care, we run the state behavioral health services and care management services statewide across all counties. And what we do is we contract with providers to deliver behavioral health therapeutic services and also care management services, as well as family and peer support services. This sort of buffet of services is very unique. We're the only state in the nation that has such a far reach in terms of children's behavioral health services that are run by a state entity that are available to anybody who calls our hotline. And they are really driven by youth and family voice and really strength-based. So essentially, when a family and youth when a family outreaches for our behavioral health services to the Children's System of Care, there is a very thorough assessment in which not only the challenges of the youth and the family system are assessed and their needs, but also their strengths. So we can leverage existing strengths to really inform coping strategies that can be tailored for the youth and family to help move them forward. The agency, or sort of ensure that our contracted service agency that manages these services and makes sure that kids and families are connected around the state, is called Perform Care. And I've asked Casey to also provide that link to their website, where there's a 1-800 number where anybody can outreach 24 hours a day, 7 days a week to engage in services. I want to add that we also have a mobile response component to this program, which provides urgent crisis intervention services to children and families 24 hours a day, 7 days a week. And within receiving a call, a team will be dispatched or virtually now to support the family to deal with any emergent crisis in the home or the community that they're seeking help for. I'm going to pause there, see if I missed anything. I want to end by talking a little bit about resilience. I was saying before we got on the call with my colleagues that so often as a child psychologist and in the field, we're trained to really look at the problems and the struggles of our youth and our families. But by far, so many of our families are far more resilient than struggling. And I think we have to keep that in mind as we look at this pandemic head on and really figure out how to help our youth and families, because there's a lot of strengths that already exist within our community. The research has shown us that there's 2 factors that contribute and are connected to resilience, and that's interpersonal relationships and intrapersonal relationships, your relationship with yourself and your relationship with other people. And those are the 2 key factors, again and again, that are shown to promote resilience. So when we think about our youth and families and those that are struggling, we can leverage those relationships or those connections to help build personal awareness about how people can take care of themselves, how they can cope, and how they can get through this crisis. You know, there's a lot of good resources online, and I'm reminded what a powerful voice our youth have. If you just do a quick Google search on youth perspective on coronavirus and COVID, you'll find some beautiful poems and artwork sort of depicting some of our children and adolescents' perceptions about how we can and will survive the pandemic. And I was reading through some of the poems that were written last night on a website, Voices of Youth, and one adolescent said, "It's important to remember, like Superman would say, you are much stronger than you think you are. Trust me." So thank you.
Diana, thank you very much for that. That was a lot of information that you shared with us. And I know for me, it was a fair amount of new information for me. So thank you for that learning. I'll turn it over to Casey to moderate this Q&A.
Great, thank you. So again, a reminder, you can raise your hand through the participants function, drop a question into the chat, or if you're on the phone with us, unmute yourself. I do see one question in the chat. Diana, are there specific indicators that a parent or educator should look for as it relates to mental health in young people? This individual is concerned that some of her students may be disconnected and not in a good place.
Yeah, I think listen, our teachers are very connected with our kids. And if a teacher is feeling like there's a deviation from sort of a child's baseline functioning, listen, all of our kids are experiencing some shifts, some change in how they're feeling, and that's very healthy. What we have to look for is a pattern of behavior changes over time. So 2 pieces. You have to look for a change in functioning, whether it's mood, a significant change in mood, more nervousness, more sadness, feelings of loneliness, withdrawn, isolation, not asking questions, not raising their hand in class, a change in functioning at home in terms of taking care of oneself, whether it's eating habits, sleeping habits, hygiene habits, and then looking for a pattern over time. So is this extending beyond a few days? And it's hard to give you one concrete answer because developmentally kids are so different depending on their age, right? But I think the best thing you can do is ask. Ask, is everything okay? I think more often than not, our kids will tell us and give us the most honest answer. I have my own little one at home, and being a psychologist is definitely an occupational hazard. I probably ask way too much how she's doing. Are you sure you're okay? Anything you want to talk about? And, I think as long as we keep the dialogue open and let kids know that we're willing to listen and we don't do it with our hand on our, with our phone in our hand or looking at a different way or multitasking, but really giving them our full attention, I think for the most part, kids will give us the clues we need to know if they need help. And when in doubt, you can call somebody and consult with them, ask them. The 1-800 number for the Children's System of Care that's run by Perform Care, again, Casey's going to put up the number, is a very good resource to reach out to just to get some feedback.
Great, thank you. Is there any other questions for Diana? We'll probably want to get them in now. I see one here. are there specific techniques that people can practice at home to reduce anxiety?
Yeah,
and that's probably one we can open up to everybody too on this call. So yeah, go ahead, Diana.
Yes, absolutely. There's a lot of research on the utility of mindfulness, which is very broadly defined depending on what you read on the web. But basically, any kind of technique, whether it's yoga, deep breathing, visual imagery, progressive relaxation, anything that's going to physiologically calm the body will help calm the brain, because the body and brain are so interconnected. That is the number one easiest go-to for anxiety. And there's a lot of apps for adults. And there's a lot of apps for kids too. And there's a lot of free YouTube videos that do guided imagery for kids and adults. And there's something called Go Noodle, which is a free app for kids, gonoodle.com, which has a lot of mindfulness activities integrated into it that are brief for kids of all ages. So definitely mindfulness is the low-hanging fruit.
Great, thank you.
I would agree with you,
I'm not
Diana,
seeing
about
any...
mindfulness as well as the things that you always do to cope with stressful things. Are you exercising? Are you sleeping right? Check on those basics. Getting back to what basically keeps us healthy, it really does help.
And I have a question from the chat box. What was the app for adults that you were talking about, just as a reminder? Was there a specific one in mind, or anyone that you're thinking about that you've seen, Diana?
Oh, sorry, yes.
That's okay.
For adults, gosh, there's a gazillion. I can probably give you, I'm not, Calm is one app that has very good reviews. That's not free, but it's a nominal price per month. Calm, and I'm blanking on the other one, but I can let you know.
There's one.
The other thing I just want to mention.
Go ahead.
Go ahead.
There's one that I like to use, and I use it, and my kids use it too. It's called Breathe to Relax, the number 2. Like Diana said, there's so many, but that's one that particularly I love on my phone, and it has a nice little way to kind of count you up and down, and you can do a short exercise or a longer one depending on how stressed you feel in that moment. But Breathe to Relax is one that I love.
Great.
I just wanted to also mention that I think it's really important to pay attention to the messaging through social media and any kind of media that we're receiving. I can say a lot about the messages kids are receiving through TikTok. My best advice, without going into a lot of detail, is just to watch it with them. If the kids are using TikTok or any kind of technology, if they have access. And I would also really say to all the parents and caregivers that there's a lot of normalcy around drinking right now, alcohol, and eating. There's not, you can't look at FaceTime, you can't look at Instagram or TikTok or any of those platforms and not see a lot of sort of joking and sort of normalcy around a lot of these unhealthy habits. And going back to what Megan said, it's really important that we remind ourselves that we are stuck at home. We have to make sure that we continue to eat well and take care of our bodies. We're not getting out and moving around in the same way we used to. And just because this is very glorified on social media does not mean it's not a good way to take care of yourself. And I think that that's something that we really need to reiterate over and over again with everybody at every age.
That's a good point, Diana. If I could also say, with what kids are watching, if you're watching the news 24/7, they're absorbing it. It's not good for you.
Yeah.
It's not good for them. I mean, obviously we want to know what's going on. We need to know, keep updated on what's safe, but it does not need to be background all the time.
Yeah.
Yeah, thank you. Thank you for all of that information. I would also say, I think the one, there were a lot of through lines and some common denominators that Jaime and Megan and Diana shared with us today. And one in particular that I want to underscore is that unlike other crises and disasters that we may have experienced here in New Jersey and, you know, the greater metropolitan area, this crisis is affecting every one of us. So it's not some other people that need, you know, counseling, or some other people that might be dealing with challenges or financial challenges or job losses or homeschooling children. It's all of us on this call. It's all of our families and friends. It's all of our neighbors. So, you know, I think together we can continue to support each other to make sure that we're as informed as we possibly can be, and to be patient with each other as well, right? Like, I know I have to be patient with myself at times. I need to be patient with my family and colleagues and friends, and I need, you know, just what all of you said, do what I can to take care of myself and everybody around me, right? Because all of us are going through this and we're experiencing some difficulty in some way. There are varying degrees of that difficulty, but we're all in this. So we are at the end of our hour, but we want to just take a couple of quick things. One is I want our team member Jeanette just to be able to say hello to everybody. Most of you know Jeanette, but Jeanette, if you want to just unmute yourself and say hello, and please be sure to be connecting with us on social media. It's a great opportunity for us to be able to share out your information. So Jeanette, I won't say everything that you're going to say.
Oh, thank you. Good morning, everyone. I particularly love this session because I think mental health is important to all of us. So I am the program associate here at Creative New Jersey. I just put in the chat again all of our group pages. We have about 10 group pages on 4 different platforms, so you can connect with us on LinkedIn, Facebook, Twitter. We're also on YouTube and Instagram as well too. So take it away, Elizabeth.
Great, thanks, Jeanette. You know, some of you have asked in the chat today, just, you know, can you get all of this information in an email? Yes, Jeanette and our other team member, Alyssa, are working on capturing all of those notes, and then Casey puts all of that together, and we make sure that we publish summary reports of all of the calls. So today's call will have a summary report. It's also, as you know, being recorded, so the video will be uploaded. We've got all of that other information on our website, creativenj.org. You know,
and I've just dropped the link in for the specific COVID-19 resource page there as well that we have on our website, where you can find all those things.
Great. Thank you, Casey. And, you know, thank you, Jamie. Thank you, Megan. Thank you, Diana, for being with us today, for sharing really important information. You know, one of the things that I learned after Hurricane Sandy is that, you know, we've got the voluntary organizations active in disaster, which Megan referred to on the call today. So that's a whole ecosystem of nonprofits who respond in a multitude of ways when a disaster and a crisis hits. Then we have this whole other ecosystem of nonprofits and philanthropic organizations in our social sector who are not necessarily connected to the organizations that, and to our, you know, Department of Human Services and other state departments, which is where Megan and Deanna are from, and that Jamie's organization, the Mental Health Association in New Jersey, works so closely with. So we want to help try to close that gap, right, between all of the really important work and services that are offered at the state and all of the work and important services that are offered in the nonprofit sector, right? So we want to help connect each other. We want to make sure that we all know about what each other are doing so that we can take advantage of and leverage that work, right? Let's close that gap between what the state, the really important work that our state is doing, and the really important work that our nonprofit community is doing, okay? So let's all be a part of working together to close that gap. Next week, I'll say quickly, we've got, as Casey mentioned earlier, next week's call is going to focus on how people with disabilities are navigating the COVID-19 crisis. We've got Joseph Galetta, and Joe is, let me just find my notes here. Of course, I'm talking, but I don't have my notes in front of me. So Joe is with the Office of Emergency Management at the Department of Human Services. I first met Joe when I was working on Hurricane Sandy recovery work. So he's going to give us that 30,000-foot view. He was a former state trooper. He's extremely knowledgeable. Joe is going to be joined by Scott Elliott, and Scott is the Executive Director at the Progressive Center for Independent Living. And then they are also joined by Dr. Bernice Davis, and Dr. Davis is the Executive Director at the New Jersey Commission for the Blind and Visually Impaired. So we've been able to develop next week's symposium in partnership with our friends and colleagues at the Center for Nonprofits, Debbie Duncan. So a shout out to Debbie for all of her work in helping us put this together. And also, right, thank you, Debbie, and Crystal Allen from Eyes Like Mine, based in Newark. We first met Crystal doing our Creative Newark Call to Collaboration work. So we thank Crystal and her team for helping us to do that. And then we've got some other calls throughout the rest of the month, right? We're gonna focus on seniors. And we're going to focus on security as well. So, and then another one to be announced. So I think that's about it for today. Remember, if you haven't done your census, please complete your census form. Please ask your family and your friends and your colleagues if they've done it as well. We want to make sure we continue to do that. Let's stay connected. Let's continue to share information. We thank you very much for being with us today. Once we stop the recording, which will be we're going to stay on, as most of you know, in case some people want to share some other information or connect with each other. So again, thank you, Jamie Angelini and Megan Sullivan and Dr. Diana Salvador. Thank you very much for sharing your information with us today. Stay safe, everyone.
And I've dropped in the registration link for our future calls. So if you aren't registered for those and you want to, absolutely use that link. You can also find it on the homepage of our website. So we look forward to seeing hopefully all of you again in the coming weeks. And at this point, I'm going to go ahead and stop the recording, and then we'll stay on for some additional conversation.